They've given me a call because they're really worried about a Staffordshire Bull Terrier called Rosa. So I need to go up to investigate, and I really hope there's something that I can do to help.
Hi, Scott.
Hi, Sonia.
Animal rescuer Sonia is waiting for Scott.
I'm fine, thank you.
Now, here you've got a pretty sad case to come and see me today.
Yes, you're here to see Rosa.
I'd love to see her,
Lovely
yeah.
little Staffie, but
good.
in quite a bad way.
Oh, dear.
Today, there's a full house of abandoned dogs which need new homes.
Wow, you've got lots of dogs in at the moment, haven't you?
We've got a few puppies in,
Yeah.
and then we've got Rosa up here.
Hello, Rosa.
Hey, Rosa.
Hello, beautiful girl. How are you?
Rosa was picked up by the dog warden after being found wandering the streets of London.
Hello, gorgeous. So yet again, another stray Staffie, hey? Very overrepresented breed, aren't they?
Unfortunately, it's very common with Staffies. Most of the dogs that come into rescues are Staffies or Staffie types.
I think Staffies get dumped so often in rescue centres because the people that think that's a perfect dog for them are not getting them for all the right reasons. People should want a dog for the companionship, for the love and the affection that the dog gives. But some Staffie owners see them as literally a status symbol. They haven't thought about all the welfare needs that this dog has, and very quickly they realise that they can't keep the dog. They then throw it into a rescue centre, and that's where they languish.
She's very, very happy.
Yeah, although very, very thin. Look at all those ribs, Rosa, hey? You need some feeding up, don't you, my love? Hey?
I don't understand people that can dump their dogs. I can't get my head around it at all. Rehome it the proper way. There's people around to help these days. You don't need to abandon your dogs.
Hey, look at you. Aren't you just lovely?
Oh, lovely Staffie smile.
Look at that big smile you've got, hey?
She's quite a happy little girl. Just hoping that we can get her a perfect family.
But first, Scott is giving Rosa a total health check. Apart from being underweight and suffering superficial skin problems, Scott soon discovers a far more worrying issue.
There's actually some hard lumps present along the strip of mammary tissue here. Can you feel those?
Oh God, yeah, I can really feel really hard lump.
Yeah. So basically, she's got lumps in her breast, which, for any female is concerning. It's not something that we can just quickly remove and go, oh, yes, that will be absolutely fine. We need to look into this, understanding what kind of lumps they are and whether they'll affect her future.
Okay.
Scott is guessing that Rosa is about 8 years old. It appears she has been used for excessive breeding before being dumped.
Overbreeding is fairly common in Staffies, unfortunately. They are bred by unscrupulous breeders. They are bred every single season, so that means every 6 months, these poor dogs can be having yet another litter of puppies. So I think what we're going to have to do is take you to Leafy Richmond, check her over and see how she's going, and make sure that she is going to have her forever home.
Oh, thank you. Hey. Rosa's going to make a perfect pet for somebody. I love her. Really love her. I'd love to take her home myself.
Yeah, that's a killer. That's a killer
bye
of a dog,
kiss.
isn't it?
Goodbye kiss.
Oh.
See you soon.
So do you want to come back to Richmond with me? Hey, beautiful Leafy Richmond? Hey, or do you want to crawl back to Richmond?
I think she does.
Crawling back to Richmond, it's a bit of a distance.
Go on then, you go first.
At home in Isleworth, southwest London, one of Scott's long-term patients, Domino, is enjoying some fun and games with the family.
Domino's 15 years old, and we got him when he was 8 weeks old. My dad arrived with a cat carrier with 2 kittens inside, and he said he had a present, one each for his grandchildren. They fell in love with them. I couldn't say no, and we ended up with Domino and Licorice.
But while Licorice likes his own space, Domino loves being the centre of attention.
Good boy. He's very spoiled, and I think he thinks that he is a human rather than a cat. Domino, no.
But 6 months ago, Domino suddenly became ill.
He went from being a really big, chunky, fat cat to a complete bag of bones within 2 weeks. And we were frightened to go to the vets because we thought they're going to put him down.
What's that, mate?
Blood tests revealed Domino has a condition common in older cats, known as hyperthyroidism.
You having a little massage? You like a little massage?
One of his 2 thyroid glands is overproducing a hormone called thyroxine. The excessive hormone pushes up his metabolism, causing extreme weight loss.
Domino. Sometimes.
The elderly cat has now been on medication for 5 months.
In it goes. Come on, it has to go in. I hate giving Domino his medication. Domino hates me giving him his medication. He hides. He will spit the tablets out if he can. No, don't break my fingers.
If that wasn't bad enough, recent tests show he's not responding to the medication.
There's a good boy. I know you don't like it.
Scott has now told the family Domino needs surgery to remove the abnormal thyroid gland. But there are serious risks involved in a 15-year-old cat going under a general anaesthetic.
I'm hoping for Domino to come out the other side and be happy and healthy and get back to his normal self. But we don't know if that's going to happen.
The family will have one last night of cuddles before Domino's big surgery tomorrow.
Oh, is that nice? He likes that. Yes.
This way. Come on, Rosa. Let's go meet the team, shall we? Oh, you're keen. Come here.
Scott's arrived back in Richmond with little rescue dog Rosa.
Hi, Rosa.
The friendly Staffie is an instant hit with receptionist Kirsty.
Kirsty a kiss. Hey.
Sit on my lap. You comfortable? Oh, you're lovely, aren't you?
She's beautiful.
You're so friendly.
I know. All right, well, let's get you off Auntie Kirsty's lap, eh? And go and check out those lumps. Come on, Rosa.
Oh, bye, Rosa.
Good girl.
Scott's concerned about lumps in Rosa's mammary glands and plans to remove one so it can be tested.
So this is Rosa. Oh,
Rosa.
good girl. Gorgeous.
Oh, hello.
Frisky.
Full of energy, eh?
Hi.
Assisting Scott are head nurse Emma and newly
Oh,
graduated
my
vet
goodness.
Riaz.
She is clearly a dog that's been bred a lot.
Oh, honey. I definitely feel it on my heartstrings when a neglect case comes in. Having animals myself and being such a big animal lover and doing what I do, I just can't put myself in the mindset of other people and how they could want to harm them.
Unfortunately, there's absolutely no history. She was just found roaming around and was brought into the rescue centre.
You must have had an owner at some point, surely.
All right, guys, well, I'll leave you to get her ready for surgery and I'll be down in just a sec and we'll get cracking.
Brilliant.
Good stuff.
This is Riaz's first job out of university, and already he's discovering plenty of challenges.
I'm not really used to seeing rescue dogs because the way that we've been taught is to always get a good history and take it from there.
What a brave girl.
But when it's a case like Rosie, you just have to sort of do the best you can and, you know, put the animal's needs first.
Time to go to sleep, baby. Good girl.
We're good to go.
All right. So the big concern for this little lady is these mammary masses. And we can feel them running up these chains of teats. And unfortunately, now she's knocked out, I can even feel one at this top one. To remove all of them is a massive surgery for her to undergo, and we don't want to put her through that unless we absolutely have to. So what I think we need to do is just take just one of them away, and at the same time, we'll then spay her. And what that will do, of course, is reduce the stimulation to the area.
The hormonal
Exactly,
stimulation.
yeah. And as a result, hopefully cool down the growth of these masses, whatever they turn out to be.
Okay. And the most striking thing that we found was the number of masses. Normally, you might find one or two at a dog which is that age, which hasn't been spayed. But to find the sort of number that we did, it was quite striking.
Everyone ready to go? Okay. Yes. All right, so we just need to keep our wits about us.
Scott is carrying out the spaying on Rosa first.
Actually, her being quite skinny is quite useful, actually. It's quite easy to see what we need to see.
The spaying is routine.
Okay, I'm happy with that.
And Scott can now move on to the lump removal.
I should be able to remove that fairly easily, and actually I'm going to do it through the incision line I've already made for the spay. So I'm just going to incise over it now, kind of pop it out like a pea out of a pod. It's very pretty, it's very nice.
But now that he can see the lump, Scott is starting to worry that this part of Rosa's surgery isn't going to be as straightforward as he'd hoped.
Though it feels like it should just pop out, it's very tightly adhered to the tissue surrounding it. It's very angry looking, very nodular, very hard. It worries me, I've got to be honest. It just doesn't look good. Right, Riaz, what I need you to do for me is just pop your 2 fingers underneath and around it. Put a little bit of pressure against it for me.
At the Richmond surgery, Scott is becoming increasingly concerned that rescue dog Rosa may have breast cancer.
Something a little bit worrying.
The little Staffie was almost certainly used to produce multiple litters of puppies for profit.
I'm not that happy, if I'm honest, because I was really hoping that it would just be relatively innocuous looking, hard white ball that was just going to pop out and look very, very innocent. But in fact, what I've found is something that looks quite aggressive, just nasty. Okay, all right, there we go. So now we've taken this little bit of tissue out and the lump. What we're going to do is then send it off to the lab. I really don't know what it is right now. It absolutely could be cancer. Oh, that's you get. Good girl, well done.
So there's sort of 2 types of tumours. The 2 types that Rosa's could come back as are either benign or malignant. The benign ones don't really spread and do too much damage unless they get really big. The malignant ones have the ability to spread to other tissues and sort of do damage elsewhere, which could compromise Rosa's life.
Oh, good puppy. This is normally the time we call an owner, but sadly, you don't have one. So I'm just going to have to take on that role for a while, hey?
I think while Rosa is here in recovery, she is going to get all the love in the world. The nurses have all fallen in love with her, and already they're dying to go in and give her a cuddle once she's recovered fully.
Hey, poor baby. I think we're just going to keep Rosa close by until we can understand what's going on and what we need to do to try and save this beautiful dog. Poor Bubba. Yeah, I love you too.
Hello. How are you?
We're good, here he is.
Gorgeous.
Next day at Scott's Isleworth practice, it's time for Domino's thyroid surgery.
You going to come out and see us? Domino has a very classic condition of older cats here in the UK, which is hyperthyroidism, an overactive thyroid gland. Basically, a benign type of tumour grows on the gland and then increases its production of thyroid hormone.
When the abnormal thyroid gland is removed, it should reduce Domino's hormone levels and allow him to feel good again and start putting on weight.
How are you feeling about it? You all right?
A little bit nervous, but, you know, looking forward to it at the same time.
Yeah, he doesn't seem nervous at all, though, does he?
He's not, no.
Seems pretty chilled.
Tracy is understandably nervous about being separated from Domino.
When Domino was 18 months old, he just disappeared. I was really upset during that time. The children were very upset, and it was difficult for them because they were so young, they couldn't understand why he'd run away from home.
But to the family's amazement, after 3 long months, Domino had been found 70 miles away in seaside Brighton.
And he went all this way, look, right on the seafront. It was unbelievable. I was extremely happy, but absolutely in shock at the same time. I didn't think I was going to see him again. Oh, Doms, I love you. You're my mate, aren't you? I feel like he was supposed to be with us, and now he's sick. I have to do everything I can for him because the bond between us is just so strong. I'm off because I'm going to get upset. I'll see you later.
See you later, Trace. All right, have a good day.
Bye. Bye. Thank you.
You can tell with Tracy that there's real deep-seated emotion here. She's already lost this cat once, and this time round I know that she has a sense that she might lose him again. Yeah, it's weird to think you're going to lose your thyroid gland, but it will help because at the moment it's just behaving badly. So we just need to take it out and go home to Mummy without nasty tablets every day.
Head nurse Emma is assisting Scott.
Good boy. Little scratch.
Good.
And they're both very impressed with just how easygoing their 15-year-old patient is.
Such a gent, isn't he?
He's such a chap.
For his age as well.
He's certainly not doing the cantankerous old man thing, which, quite frankly, I'm quite looking forward to doing.
Oh, no.
Yeah, I can't
You're
wait.
bad enough on a good day. Can you just...
I'm very chipper, but I'm looking forward to being a grumpy old man. I think that'd be actually quite fun.
Jokes aside, Domino's age could pose serious problems for the anaesthetic.
I'm really glad that I've got Emma, my head nurse today, here with me because she's the most experienced nurse that I have. And in these cases where you've got an older cat that has lost a significant amount of condition over the last few months, they are going to be an anaesthetic risk. There's no doubt about that.
I do basically have to keep Domino alive. That is my job. I'm the anaesthetist. So if anything goes wrong, it's on me.
How are we getting on?
Well, he's bradycardic and his blood pressure is quite low.
Okay.
So no pressure, but quick as can. I'm just nervous.
Come on, up you get.
Close by in Isleworth, an unlikely friendship has blossomed between a local gardener and a rescued parakeet.
I saw this thing fall out of a tree next to me, and it literally landed, not that far away from me. But I knew there were cats and foxes in the garden, so I just picked her up and then I plonked her on my shoulder. And ever since then, we've just sort of been together.
Luan immediately gave the little parakeet a name.
As soon as I saw her, I just thought Pablo, without even knowing if she was a male or female. But from day one, I felt very affectionate towards her, and she seems to show a lot of affection back to me.
The two are now inseparable, and while Luan has given the bird a safe home, Pablo has given his rescuer a new life.
Last year, I've been dealing with a lot of anxiety.
So how's Pablo doing today?
And since I met Pablo, it's given me that extra confidence to meet people and go out, socialise again.
Does she have a favourite shoulder?
She does, and it's this one. I can't really think of life without her now, even though it's only been 3 weeks. It sounds crazy. Oh, yeah.
But today, a worried Luan is taking Pablo to Scott's Richmond Practice. His new friend has a noticeable problem with her right leg.
I knew from day one that there was something up with her because she wasn't flying around and, she wasn't behaving like the other birds. And yeah, I just wanted to see if she gets better.
Hello.
Hi.
Hi, how you doing?
Not bad.
How's Pablo sleeping?
Vet Joe will be looking after
do
the
you wanna bring her
exotic
through?
patient today.
Do you want to come through?
Sure.
Some people will see parakeets as a pest. She's not an indigenous native species to the UK, but in her case, she is a pet to Luan, and they obviously have a very close relationship.
She still uses her leg, but she doesn't really...
She doesn't grip
grab
very
it,
well,
no.
does she? So I'm just checking whether she's actually able to use the foot to perch. She's obviously using the left leg a bit more.
Yeah, since I found her, she's been like this.
Pablo needs an X-ray, so Joe can find out exactly what the little bird's injuries are.
She might have a fracture there, and infections can get into the joint. To get good views, we need her to stay still, so we'll just give her a little bit of anaesthetic gas.
Okay. I'm remaining hopeful and optimistic, but yeah, I'm worried.
Okay, so if you want to wait for a little bit, and then I'll update you shortly when I've got some X-rays.
Okay.
Okay. Go on then.
Yeah, it's a bit of a tricky anaesthetic, I'm not going to lie.
In Isleworth, Scott is about to start surgery to remove Domino's abnormal thyroid gland. But already the 15-year-old cat is giving head nurse Emma plenty of concerns.
His heart rate is a little bit slow. His blood pressure is much lower than I would like it. Yeah, it's keeping me on my toes, that's for sure.
Trainee nurse Gemma has been called in to help Emma if required.
Nice, healthy white nerve there. I'm going to avoid that like the plague.
Scott is also feeling the pressure.
There's some huge nerves that do very important things, controlling everything from the ability to swallow to the ability to move your tongue, even the ability to move your neck. So really, really important nerves there, and you definitely don't want to cut any of those. There you are. There's the gland there. So at either end I can see a nice clear parathyroid gland, and in the middle there is the thyroid gland, which I'm going to remove. So what we're talking here is a matter of millimeters between what is abnormal thyroid tissue and what is healthy parathyroid tissue. So I do need to make sure that I place the ligatures in the right spot and take out all of this gland, otherwise it will simply just grow back. You're sort of pretty happy with the cat now, James?
Yeah, it's stable, but it's keeping me on my toes.
Okay, so that's one abnormal thyroid gland. So this has come out nice and cleanly, and I'm ready to close.
Cats have 2 separate thyroid glands. Domino's remaining gland is healthy and will now control his metabolism, hopefully eliminating the need for any further medication.
And we are done.
Thank you.
Yes.
Never been so happy to finish surgery with you.
A relief to get this boy woken up.
Yes.
Come on then. Back you come. You've been back to Brighton in your dreams, eh?
Walks on the beach. Welcome back, buddy.
-1 pesky thyroid gland. Hey.
Never been so happy to have a cat wake up so quickly.
Yeah, good boy, Domino. Well done. Surgery went really well. The gland was abnormal looking, but I feel that I got it out completely. Oh, what a nice, cozy bed.
Snuggly.
Emma was just happy it was over. She was happy she could wake up her cat and have her patient alive and breathing in front of her. So thankfully, we were both happy with the result.
I want to get in and snuggle with him. It's
I know.
quite cozy in there.
Looks super cozy in there.
I know.
Probably quite happy you jumping in there. He's probably a dirty old man.
Stop it, you. Behave.
Hey, do you want Auntie Em to jump in for a cuddle? Hey? Bet you do, little monkey.
A few hours later, anxious owner Tracy has arrived at Isleworth to collect her little man.
Hello. I was worried about Domino all day today. He was just in the back of my mind all the time. And I couldn't wait to finish work to come and collect him.
Domino, look who it is.
Hello.
There's Mummy.
Hey, yeah. Hi, Dom-Doms. How are you?
For such an old boy, he's woken up brilliantly. Surgery went very well. He no longer has a thyroid gland on the left side, but hopefully now he'll have a life without tablets, which would be great.
Oh, that'd be wonderful. Hey, babes. Oh, I missed you today. Oh, I'm so happy. I'm really pleased that everything went well, and I can't wait to watch him put on some weight and just chill out and be happy.
All right, buddy. You ready to go?
All right, Trace.
Thank you very
Take care.
much. Thank you.
Bye. Bye,
Come on,
Domino.
Doms, let's go.
So I'm guessing she's friendly.
Yeah, she's very friendly.
I think you turned into like the exotics vet now. You don't often get birds here.
At the Richmond Hill surgery, Joe and nurse Nathan are about to x-ray Pablo the parakeet's injured leg.
Well, I'm worried there might be a fracture there. We'll have a look at the x-rays and have a look, but it's definitely that hop joint that's a bit swollen and why she's holding up the leg. Okay, we're looking a little bit sleepy. Lights. X-rays. Nath,
Yeah?
I think it's a really bad fracture. You can just see the fracture there.
Wow.
So this isn't good news for Pablo, and it's definitely not what I was hoping to find. I thought that it would be a smaller fracture lower down, where the bones were probably starting to heal, perhaps, but no, this is a big fracture, so it's a lot more serious than I thought.
Joe now has to tell Pablo's owner Luan the bad news.
How is she?
She recovered from the anaesthetic really well, really quickly. But I'm afraid the x-rays didn't give us the news that we wanted. Right. The fracture's quite high up. Surgery is an option. She's healthy, she's good weight, she's eating, and So, her chances are reasonable, but bird anaesthetic is really risky.
I thought it was going to be very straightforward. I thought she might need some medicine or even some physio. And no, it's very disappointing. I have to give it some thought, but I probably will go ahead with the surgery.
Okay.
Although Luan is nervous about the surgery, Pablo has quickly become his best friend,
Very soon,
and he'll do anything to
brilliant.
help her.
I want to give her the best fighting chance. She sort of turned up at the right time. She's helped me with an awful lot, and now it's my time to help her. Here we are, Pabs.
Next day, Luan is bringing back Pablo the parakeet for an operation to fix the bird's badly fractured leg.
How's Pablo?
She's all right. She's here to see Scott and Joe.
Yeah, do you want to have a seat? That'll be right with you.
It was a clear choice to go ahead with the operation, but today's going to be a real difficult day.
Hi, Luan.
Hiya.
This is Scott.
Hi, Luan. How are you? Nice to meet you. Hello, Pablo. Aren't you gorgeous? All right, well, it's a big day, so let's go in and have a chat, shall we? Come on in. When Joe first showed me the x-rays, it was very clear that this was a fracture that needed to be fixed. There's two sharp ends of the femur, which is the thigh bone in the upper part of the leg, and they were broken in half and folded over. It's a pretty nasty break in this right leg, isn't it?
Yeah.
How are you feeling about that?
I'm upset to hear that, she's got such a serious fracture, but, I want to do the best for her, so go ahead with the operation.
Okay. The main concerns for us is the anaesthetic. But the problem we have with her is that she is going to need to be under anaesthetic for quite a while, for maybe anything up to an hour.
Yeah.
And that is always risky in birds. So we are quite concerned about that. And then, of course, she's a young bird. And as a result, her bones aren't fully calcified and as hard as they should be. Mm-hmm. And so that will mean that there's chances that whilst placing a pin, they may fracture.
Literally in the last 3 weeks, we've bonded so much and so quickly. And the fact that there's such a risk that I might lose her, it's been difficult. Good luck, Pablo.
We will give you a call as soon as she has woken up.
Thank you very much.
Take care. We'll see you in a bit.
See ya. Bye. I'm expecting the worst, but I'm hoping for the best.
I hear she's not doing so good on one of those pins.
Yeah, so the right leg has got a fracture, and that's what we're all here for today.
Head nurse Emma is teaming up again with Scott, and vet Joe will also be assisting.
Okay.
We know there's risks, and I know that we all are nervous. I mean, I'm feeling nervous. I know that you guys are as well.
Yeah.
But all we can do is just do our very best. So we're breathing there, fine. So you can see the small light breaths there, okay? So now every 15 seconds, you're breathing, right?
Yeah.
Every second the tiny patient is under anaesthetic will be critical.
Birds are very delicate little creatures. They're very prone to stress. And under anaesthetic, they can just simply die. So it is a very nerve-wracking thing to knock a bird out under anaesthetic, and we need to make sure that we're all on our A game today. There we go, so knee there. I'm just feeling the fracture site properly for the first time. She's just so stiff. This fracture feels a lot different to what it looks like on X-ray. The muscles are so tight here that they've actually pulled this fracture underneath its knee. So it's like having its hip joint and its knee in the same position, which is clearly not correct.
Scott is now seriously rethinking his surgery plan.
Unfortunately, I can't see how I'm going to fix this surgically, because to do so, I basically have to refracture the leg.
Is amputation an option?
I don't think we need to. The reason I don't think we need to is because she can feel her leg. She can feel her leg, she can place her foot, she can hold the toes around my finger. So I'm feeling now that actually we should pull out and we should allow her to wake up, because I think that the fracture has healed, however badly. And I think that, Luan loves this bird, and I don't want to be the one that breaks his heart. Hello, sweetheart. This doesn't happen very often. I'm just about to operate, and then I make the decision not to operate. But as a vet, you do have to balance the risks of a procedure versus the potential benefits, and also remind yourself that just because you can perform a procedure, it doesn't mean that you should. And I know that I'm making the right decision in this case. Welcome back.
I think she's hungry.
She's like, get off my leg. I wanted to have a perfect leg, but hey. It seems from the examination that we've done today that Pablo isn't in any pain. There isn't any chance that those sharp edges of the fracture site could cause any further damage. The healing's been done. It's not perfect by any means, but it's perfect enough.
Hey.
Here we go.
Oh, how'd it go?
Well, it was eventful. Your bird has something we're going to newly describe as a fifle, which is basically a very odd leg, knee, thigh joint.
So it's just a fused callus, so it'll always be deformed and she'll always have that kind of claw-like perch. But she can still perch and she's not in pain.
And is that not risk of infection or anything like that?
No, because the fracture is on the inside. The slightly sharp bit of the fracture that we can feel is on the inside of her knee. So it's protected from anything on the outside.
And it's great that we've been able to give it back to you in one piece. And that's exactly what we wanted to do. And we know that we've gone through the process to try and give her the best treatment we can. And actually, it turns out by doing nothing is the best treatment we can give her.
I really wasn't expecting a happy outcome, if I'm honest. I mean, I know I said I was remaining hopeful and so on, but just the chance of her not making it, I'm really happy. She's in good health and her foot's healing itself naturally, and that she can come to work with me tomorrow again, back to normal.
How's she going, girls?
Hi. She's, yeah, she's very, very flat.
But while there's a happy outcome for Luan and Pablo, later that week, rescue dog Rosa has taken a sudden turn for the worse. The pathology results are back from the suspicious lump that Scott removed from Rosa's breast tissue.
All right, there we go.
And they show that, as feared, it is cancer.
You love a good kiss and a cuddle, don't you? Yeah, you do. Yeah, you do. Rosa, our beautiful Staffordshire Bull Terrier, is really not doing too well today. She is flat. Emma's been working with her all through the morning.
It's not how it was supposed to be, is it? It's not what we talked about.
With Rosa deteriorating so quickly from the rapidly spreading cancer cells, Scott has taken new x-rays.
Sadly, down the bottom here, there is this, and that looks like to be chest met, which is a metastases, which means that the tumours that are present in her breast tissue have spread to her lungs, which is gutting because it means that no surgery in the world is going to save Rosa. It makes me so angry that someone knew that this dog had those lumps there and simply did nothing about it, because if they did do something about it, then Rosa's life could have been saved, and that is just awful.
Hey, beautiful one. Hey, I bet you were a gorgeous little puppy.
Head nurse Emma and receptionist Kirsty are maintaining a vigil at Rosa's side.
You've become such a big part of the family. Everyone has just fallen in love with her, haven't they?
Especially me. I feel really devastated, to be quite honest. You know, I've come to get really quite attached to Rosa and, you know, considering adopting her myself, and it's absolutely heartbreaking.
Tough decisions will soon have to be made to ensure Rosa doesn't suffer.
I think the most important thing that we always have to remember is doing it for her.
Yeah, definitely.
I don't think this part of the job ever gets any easier. I think it always hurts. And I think the day that it stops, I'm not doing my job right.
Soon after, Rosa lost her battle. But she leaves a lasting memory.
Look at that big smile you've got, hey? Rosa signifies what we all love about dogs, the fact that she gives unconditional love.
Oh, good girl.
Regardless of her history and what's happened before, she loved us. And I hope that we've given her a little window into how normal dogs live, which is where they're loved.
Later that afternoon, two unexpected visitors arrive at the Richmond clinic. Scott's wife Zoe with their new puppy Scully.
Hello.
Hey.
Hey, honey.
Okay.
Look who I brought to see you just because they love you.
Hello, monkey pants. What are you doing?
There may be just a tiny but quite significant chance that there is the other end of a dummy in her.
Great. It's just that sort of day. We're all feeling flat about Rosa, and suddenly Zoe walks in with our new puppy, Scully. No, it's not a social visit to cheer us up. Apparently, she swallowed a dummy, which is not the news I want to hear right now, and I hope this isn't going to turn out to be a serious problem.
I found two dummies like this, but I've only found one of these, and the only reason I found that is because she threw it up.
Right.
So she threw that one up this morning, and she has eaten and been sick again since, but no sign of the second one.
My team and I brought Scully into the world just recently. All right, babies, out you come. Okay, here's on baby catching duty, Ems.
I'm on.
It was a complicated birth, and it was touch and go for a while there. Any luck?
No, not yet.
But her brothers and sisters and her are all fighters.
Oh, I did hear a squeak.
Squeaking!
After everything that we went through with how close we were to losing her, it is just so gutting that she's already back at the practice. All right, let me have a little feel. Unfortunately, I can feel what I believe to be this dummy. What we'll do is we'll do a quick x-ray with her conscious. We won't knock her out, and we'll see if we can see it on x-ray.
Yeah.
And then we're gonna have to work out what we're gonna have to do. I'm really worried for Scully. People might think that a dummy teat, it's soft, it should break down. But if it passes from her stomach into her small intestine, it could block. She could then get infection, she could get septicemia, and she could die. You are very naughty. Yes, you are. This is an incredibly dangerous predicament, and that dummy needs to come out. Can't be mad with you though, because you're so gorgeous. You're very naughty.
Here we go.
Baby, okay, so be ready just to take this shot once I've got her in position.
At the Richmond Practice, Scott's dealing with a family emergency.
Ready?
X-ray.
With Nurse Nathan's help, he's urgently trying to find out if his new puppy Scully has swallowed part of a dummy.
Right, let's have a look. Zoe, jump in there. So, let's see if we do that.
That's quite compelling evidence, isn't it?
Yep. You fluffy doofus. So the x-ray is fairly clear as to where this missing teat is. The concern is how we're going to get it out. It's quite big, she's quite small, and at the moment we're quite worried as to whether she's going to bring it up or if I'm going to have to go in and get it. Let Uncle Nathan hold you.
Scott is desperately hoping to avoid surgery, so he's giving Scully an injection of apomorphine to make her vomit.
I know, I'm sorry, sweetie. Right.
How quickly is this going to work, Scotty?
Very quickly. Yeah, she'll start vomiting. Hey, just pull back your ears. Just think it's this or possible anesthetic and surgery.
Come on, sweetie, throw it out, please.
Good girl. That's it. Sorry, sweetheart.
Come on, baby. That's it. Go on. Throw it out, please. That's it. Go on. Go on. Come on. Anything?
The injection works. but there's no sign of the teat.
Come on, baby.
But on the second attempt...
Hey! Good puppy! Good puppy! Oh. Good puppy. Keep on being sick. Normally I wear gloves for this, but with my fingers covered in our dog's sick, it must be love. Hey, must be love.
I've never been quite so excited to watch a dog vomit. And she's avoided surgery. It was like a trainer conversion all in one. But I would like her to not eat anything like that again.
Good puppy. Hey. It's an incredible relief and a weight off my shoulders that Scully's brought up this teat. It seems like a little thing. It's just a bit of plastic that a little puppy's vomited, but it means her daddy doesn't have to put her under the knife and perform surgery. So we're all very happy. No more dummies in the Miller household. No. All right? Poor baby. Hey, Tracy, how are you? Good to see you. Thank you very much.
It's time for Scott to check up on Tracy and his patient Domino. After surgery to remove the 15-year-old cat's troublesome thyroid gland.
Here he is.
Hello, handsome. How are you? Wow, Tracy's looking amazing.
He is, isn't he?
Yeah.
He's put on lots of weight.
Domino looks fantastic. He's much calmer. His coat looks better. He just looks great. A big sook, aren't you?
2 weeks after Domino's surgery, you could see a huge difference in him. He stopped crying for food and become a lot happier.
And are you finding that he's a little bit quieter as well? Because they're pretty vocal hyperthyroid cats.
Oh, he's much quieter. We can eat dinner in peace without him singing all the way through. Domino's always been an affectionate cat, but now he's even more so. For such an old cat, I think he's got a new lease of life. Where he'd stopped purring, you could tell he was unhappy, and now he purrs all the time.
Oh, isn't that great? So he's found actual happiness.
He has. Yeah. You can see he's a lovely, healthy cat now.
Tracy's been an incredibly brave owner. For any cat owner to put a cat that's as old as Domino through surgery is always fairly daunting, but we've got a fantastic result in this cat is now comfortable, he's happy, he's relaxed, and he's enjoying his company again with Tracy, so it's a fantastic result.
Take the doggies for a swim.
Yeah, is that lovely?
Here we go. Here we go, Papa.
Scully's like, this is
girl,
very
Betty.
new.
What do you think?
As for mischievous little Scully, she's been on her best behaviour since the dummy ordeal.
It's a good girl.
And today, Scott and the family are enjoying some precious playtime together.
Daddy, can you...
It's like a wet mop head. You want to hold that? She's made a huge impact on our lives. The kids absolutely love her. Betty adores her and she's got a new spring in her step. And I honestly can't see a life without her. What do you think, Scully? Any good?
For Scully's first go.
Not too bad, although Scully does turn out to be a drowned rat underneath all that.